Smart moves! Subscapularis pain, a common martial arts injury that I see quite a bit is people having pain in the subscapularis. Rotator cuff is a common injury across all cultures and across all hobbies. However, with the subscapularis in particular, it's kind of a difficult muscle to access because it sits underneath the scapula in between the posterior ribs and the scapula itself. I did have somebody from one of the martial arts forums on Facebook write in and ask about how to treat this. So we're going to address that today. Let me show you the anatomy first. So here we have the subscapularis highlighted. We are looking at the front of the body right now, so these are the anterior ribs. And as you can see, that subscapularis is tucked in between the scapula itself and the posterior ribs. And the insertion is right here on the humerus. So that insertion can be accessed at a point called Heart 1 in Chinese medicine. Of course, acupuncturists, this is a point that we almost never use. But it is a fantastic tween-na point. Needling it is okay. Just be careful if you do decide to needle it. Make sure that it's somebody who's comfortable with you and comfortable with their own anatomy, because the armpit can be a kind of embarrassing area. Also, just be careful because there are nerves that run superficial in that area, and if you touch the nerve with the needle, it's going to be pretty sensational. So, to access this for acupuncturists, you can just lie your patient down on your table supine and have them drape their arm over the top edge of the table. And you can use tween-na along the entire heart meridian, and you can poke around in here in the armpit itself to find the Ajmani point or the O-yes point, and you are going to find something on fire if your patient does have subscapular pain. For home acupressure, this is actually very easy. Choose your ball of choice. So I've got right here the lacrosse ball, stone ball, and salt ball. You can also use a tennis ball if that's convenient for you, or if you want something a little bit softer. Home acupressure. Go ahead and take your ball of choice. Just jam it in your armpit and fold your arm over the ball. Find a surface that's comfortable for you to press on and catch your arm between the table and your own rib cage. And you can press on this. Go ahead and find the point that's on fire. It's supposed to be pretty achy, and press on it for 1 to 2 minutes. You can also cross fiber if you want to go ahead and try to break up the fascia in the area that may have some adhesion, some scar tissue. Keep being smart. I'll see you next time.